Hello, I'm Dr. Nandini, Senior Consultant Gynecologist at Akkineni Hospitals. Wishing you well. In this session, I'll highlight some important points. Please stay tuned and take notes.
Welcome to this explainer. It's incredibly rare in medicine to have a test that can literally stop a disease before it even exists. Yet for so many people, this routine procedure is a huge source of anxiety, and it's often totally misunderstood as some scary cancer test. Today, we're opening up the medical black box. We are going to reframe the Pap smear into what it truly is, a deeply empowering, highly effective prevention tool that stops disease right in its tracks. Here's our roadmap for today. We're going to quickly cover a medical success story, how the test actually works, decoding your results, the HPV connection, and finally your screening schedule. Let's dive in.
All right, kicking things off with Section 1, a medical success story.
To really grasp why doctors push this test so much, we actually have to look way back to the 1940s, when Dr. George Papanicolaou came up with its earliest form. And what is truly mind-blowing about this medical achievement is its real-world impact. In countries that have established screening programs, the Pap smear has slashed cervical cancer mortality by up to a staggering 80%. To put that into perspective, we just have to look at regions without widespread screening coverage, like India, where cervical cancer tragically remains the second highest cause of cancer mortality for women, simply because this preventative tool isn't widely utilized.
Now, here is the absolute aha moment of this entire explainer. The Pap smear isn't actually looking for cancer. Nope, it's specifically hunting for cells with abnormal features, which your doctor might clinically call dyskeratosis or dysplasia. Catching these precancerous changes is thrilling from a medical perspective because it means doctors can treat the area long before the disease ever has a chance to develop. So it's not just early detection, it is true proactive prevention.
Moving right along to Section 2, how it actually works.
Look, medical anxiety almost always stems from the unknown, right? So let's completely demystify what's going on down there during this brief exam. The entire physical goal of the procedure is just to collect cells from a very specific tiny area called the transformation zone. This is basically just the exact junction where the squamous cells on the outside of the cervix meet the columnar cells on the inside. Why target this exact spot? Because this is the precise neighborhood where almost all cervical cancers originate. And what's kind of fascinating about the physical procedure itself is just how low-tech yet super effective it really is. During a standard exam, a speculum is first placed so the doctor can visualize the cervix. Next, a tiny brush or a spatula gently swipes some cells from that transformation zone. Finally, that sample is either smeared onto a glass slide or popped into a liquid preservative to be sent straight off to a cytopathologist. That's it. The actual collection takes literally just a few seconds.
Honestly, knowing that this takes just seconds is usually the ultimate anxiety killer. It's a highly manageable process that isn't painful for most women. The typical sensations are really just a brief moment of mild pressure or maybe some very light cramping. And hey, if you experience a tiny bit of spotting afterward, that is completely 100% normal. Knowing exactly what to expect physically is honestly the best way to dramatically lower the stress of making that appointment.
Okay, on to Section 3, decoding your results. Let's tackle the part that usually triggers those late-night panicked internet searches. We're going to translate those intimidating lab results into plain, everyday English. So, a normal or negative result, that's exactly what it sounds like. No abnormal cells, see you at your next routine screening. But what if your results say LSIL or ASCS? I know, those sound scary, but they just indicate mild abnormalities, often reflecting an active HPV infection. The huge relief here is that these usually clear up entirely on their own. The typical next step is just a repeat smear or an HPV test to keep an eye on things. On the other hand, HSIL or SIN2 or 3 points to moderate to severe precancerous changes. Don't panic, but this does require a closer look, usually through a magnified visual exam called a colposcopy, a biopsy, and possibly targeted treatments like a LEAT procedure to just safely remove those cells. Finally, if actual squamous cell carcinoma is found, urgent staging is required. Understanding this scale takes all the scary mystery out of a callback from your doctor.
Let's pivot to Section 4, the HPV connection.
You have definitely heard of HPV, or the human papillomavirus, especially over the last few years. To understand how it fits into modern screening, let's look at this like a medical detective story. The traditional Pap smear? That's looking for footprints, the physical, visible changes left behind in your cells. An HPV DNA test, however, goes one crucial step further. It's actually looking for the culprit, the high-risk virus itself, even before it has a chance to leave any footprints. It is identifying the root cause before the damage even begins. And this brilliant two-pronged strategy leads us to something called co-testing. By combining both the Pap smear and the HPV test, the medical field creates an almost impenetrable defense. Utilizing both tools provides doctors with the absolute maximum sensitivity for spotting any risk of severe precancerous abnormalities. Because this combined approach is so incredibly sensitive, a lot of countries are now actually adopting primary HPV screening as their preferred frontline defense.
Which brings us to our final part, Section 5, your screening schedule.
All right, now that we understand how the tools work, let's map out exactly when you need to schedule your appointments based on current guidelines. You should begin screening at age 21 or within 3 years of your first sexual activity. From ages 21 to 65, a routine Pap smear is recommended every 3 years. But notice the big aha moment right there at age 30. You gain the option to switch to HPV DNA testing every 5 years. We get to safely space those appointments out precisely because the HPV test sensitivity is so remarkably high. Finally, at age 65, with an adequate history of negative screenings, you can safely discontinue the tests altogether.
Now, a super important caveat here. There are exceptions to this standard timeline. If you fall into a high-risk group, say you're living with HIV, you're immunocompromised, or you have a prior history of severe cervical abnormalities, your screening schedule will need to be a lot more frequent. Why? Well, because an immunocompromised body just has a much harder time clearing the virus on its own. In these situations, your doctor will work with you to tailor a specific accelerated timeline to make absolutely sure you stay safe.
So, we've unpacked the whole thing. We've demystified the physical procedure, decoded the lab results, and armed ourselves with the knowledge that this test literally stops cancer before it starts. Think about this provocative fact. If everyone followed this simple schedule, cervical cancer could be practically eliminated in our lifetime. So I'm going to leave you with one final vital question to consider for your own health. Knowing what you know now, are you up to date on your screening schedule? Taking just a few seconds out of your year can give you literally decades of peace of mind. Thanks so much for joining me for this explainer, and go take charge of your health today.